to do an NG tube insertion, enteral feedings, and discontinuing the NG tube. As I walk into the room, I'm going to check my physician's order and identify my patient, his name, date of birth, making sure that the patient does need this NG tube insertion. It could be for feeding the patient that is in critical care. It could be for GI bleeds or gastric perforations. So whatever the doctor's ordered for him, you need to be knowledgeable of that. So I'm going to go ahead and get started. I'm going to wash my hands and don clean gloves. And I'm going to get all of my equipment set up and everything that I need for the procedure. I'm going to get my tape already lined out that I need to use during the procedure. And then I'm going to set the patient up into half hours. And then I'm going to check his nostrils for patency. And so I'm going to occlude both nostrils, checking to make sure there's no obstruction of the airway and that he can breathe through each nostril adequately. And then I'm going to get my pad and I'm going to place it on the patient's chest just to make sure he doesn't get any drainage or droppings or vomit on him. And then I'm going to get my equipment set up. And the first thing I'm going to do is measure how much tubing needs to be placed in and mark it. So I'm going to take the tip of the tubing and place it on the xiphoid process, and I'm going to work my way up to the ear and all the way to the tip of the nose, and I'm going to hold that in place and get a piece of tape and mark it to how far I would want to put this tubing, and this should stop right at the tip of the nose. So now I have that marked. I'm going to get my water-soluble lubricant, and I'm going to place 3 to 5 inches of the tip of the tubing in the lubricant. Okay, so as I'm about to begin to start the procedure, I'm going to tell the patient to place his chin down to his chest and swallow as I insert the tubing. And I have my water ready to go in case he needs it. So I'm going to tell him, go ahead and place your chin down and start swallowing, and I'm going to put it in, pushing downward and backward all the way to the place that I have marked on my tubing. And once he gets there, we're going to stop. And during that process, if any kind of gagging, cyanosis, trouble breathing, if he's not being able to breathe or hum or talk during the process, and it looks like he's having difficulty breathing, then we need to discontinue and take the tube out. But he didn't have any problem, so it looks good. We're going to temporarily secure the tubing to his nose, and we're going to check the gastric contents for pH level to make sure it's in the right place. So we're going to take this off, and we're going to get the syringe and take out just a little bit of the contents, secure it back, and we're going to have our little pH strip right here, and we're going to put the gastric contents on the pH strip and let it read it, and it's come back red, which means that the acidity level where it's placed is in the right area, which is the stomach. So once we've done that, we're going to send it down for x-ray to confirm the placement, and we're going to secure the tubing to where it will stay on long term. We're going to get a piece of tape and go around the nostril. That's good. Okay, so now that we got the NG tube secured and we have confirmed the placement by x-ray, we're going to go into the enteral feedings. So with the enteral feedings, we're going to go back and look at the doctor's orders and see what he has called for this patient. It could be a feeding tube, continuous feeding pump, or it could be a bolus if it's continuous feeding. There would be a rate that is given, and it's usually about 25 milliliters an hour, and they start off with that, and then they can gradually increase depending on the patient's nutritional needs or how they tolerate it. And if it's by bolus, then it's the rate is given by gravity, and it's held up by a IV pole, and it's given all at once at however fast the gravity takes it, and then you can you flush 30 milliliters after the bolus, and and then that infusion is done. If it's a continuous feeding pump, then you would check it every 4 hours. And you would check the gastric pH, and you would flush it with 30 milliliters every 4 hours until the pump is done with this process. For this video, we are going to be doing a continuous feeding pump. So I would go and confirm that this is the doctor's orders. I would go and get the formula. I'd shake it up. So here's my formula. Shake it up. Have it ready to go. I'm going to make sure that the gastric pH is right. So I would take out and check for the gastric residue. And so if it's less than 250 milliliters, then I would, that is good. That means that he can adhere to the feeding. If it's more than 250 milliliters 2 times within an hour, or 500 milliliters, then you do not need to continue with the feeding because his gastric residual is too high. Excuse me. So his residual was less than 250 milliliters, so we will be continuing with the feeding. So I'm going to take his residual, put it back in, and then I would chase it with 30 milliliters of water and flush it. And then I would take the formula and put it into the bag. And then I'll take the tubing of that bag, attach it to the tubing, and then I would make sure to prime it. I would hang it, and then I would turn on the pump and set the rate at 25 milliliters an hour, or whatever the physician has ordered for this patient. Okay? And then I'll be checking it every 4 hours, checking the gastric residual, flushing with 30 milliliters of water every 4 hours, making sure the patient is adhering to everything well. And okay, so then we fast forward and the infusion is done, and we're going to discontinue and take out the NG tube. So the first thing we would do is flush the tubing with 30 milliliters of water. So we're flushing it. Okay, and now I'm going to tell the patient, all right, we're about to take out this NG tube. I need you to hold your breath for me as I take it out. I'm going to take off the tape. That's securing it. I'm like, all right, go ahead and hold your breath for me. And I'll take it out. And then discard. And then, so I discarded this, threw it away. And then I would perform oral and nostril care. And then I would take off my gloves, wash my hands, clean up my station, and then I would record just about everything of the procedure, how he tolerated the procedure, the size and the type of tubing I used, the gastric content level, or residual level, the type of formula I used, which nair I put it in. I would document the rate of the internal feedings, and then I would and how the patient